right, here we are at the feet. And this is the foundation of our wellness. Our feet make a huge difference in our posture, in our gait, in everything. So we have issues from people with a background in dance, gymnastics, things we did as children, shoes we wore. I work on a lot of models, that used to be models 20, 30 years ago, and we've got some severe foot problems. So what we can do is go in with the vacuum and actually lengthen the fascia and help that to stretch out and relax and glide a little bit again. And again, plantar fasciitis is itis, inflammation. So we're also going to just pull that out. Doing some rolling rotations here. This feels amazing. And if any of you do reflexology, this does reflect up to the rest of the body. This work is amazing for diabetics. The neuropathic issues they deal with and the fear of not being able to feel their feet. So please work on people with diabetes. If we can drain the feet, very often they can get some sensation back and start walking again. So neuropathies from MS, all kinds of things. You can do a lot of help for people. So right now what I'm doing is flexing the foot and just working up and down, all through the fascial sheath, all through the attachments. And you see the difference in color, how she got nice and red through here, and then this is staying very white. So we know there is an issue with blood flow in here, which means restriction. So plantar fasciitis, very often I come in, park right over, and again, you're always lifting the cup. You want a little more suction, and it doesn't hurt the person, increase it, and flex the foot. Bring it up, flex the foot. Some twisting movements down, again, always lifting the cup, not pressing it in. Little twisting here and there. And you're gonna feel like bubble pack in here, it's amazing. And of course, you have to address the heel. You really, with plantar fasciitis, you must address the posterior leg, the Achilles tendon, and gastroc. Actually, it travels further up the leg, very much like carpal tunnel. It really starts in the neck for a lot of people. So working over the calcaneus here. It's a good thing to keep your tube attached to your machine. Right over here, the calcaneus. Working that. Nice color we're getting. And now do you see we're starting to get some blood flow into this white area of her foot. There we go. A little bit of pink. That's what we wanted to see. And again, any contraindications that are contraindicated for massage are also contraindicated for massage cupping and metacupping. So it is contraindicated to work in this zone on someone who is pregnant, and I've already cleared that this is not the case here. So I will come up and drain right around the medial malleolus. Bring that right up. Now this is the same leg on our model that had the scar in the gastroc that was impeding some lymph flow. So we're gonna make sure her lymph is flowing and that her ankle does not swell up on her again. So you can feel the restriction in the cup. This actually feels yummy, especially if you've had a lot of debris sitting in here for quite some time. Nice. We had a fellow at a show whose foot had broken so badly it was turned backwards. So that happened in 1984, and I got him on the table about 3-4 weeks ago. We improved his gait in such a way, it was amazing. Just opening the scar tissue up, loosening the fascia, and getting his lymph flowing again. He now has, an increase in movement of almost 60%. So he's a very happy man. There was no flexion or extension of that foot before we were able to help him soften it up. So it's just a great technique. The vacuum is just a wonderful addition. And the biggest thing with this is everything else all the other techniques, you can translate with the cup. The psoas work is really impressive. You will find that you're going to be changing a lot of your ways of working. And it makes it a lot more comfortable for the person on the table. Now for fun, this really cute little cup. So now I can get in and really, would you feel that? You feel like a sandy, kind of sugary crystal formation in here, all the old debris from when she had this accident. Just drain all of that up. Our goal here is not only to drain her tissue, but get her lymph system going again. We want her body to take over so that we don't have to keep coming in and working on it. So one more pass here. She's got a real tight area. There it goes. Now just for fun, do you see the difference in the flexion now? Can you see that? Big difference. So before we get you off the table, I have to balance you out because I can't leave you like that. But this is a huge increase. I mean, I'm really pressing on her. If you can see it better, are you okay with me pressing that hard?
Yeah.
Look at the difference in the angle here.
Yeah, that was pretty crazy.
Pretty nice.
Amazing.
So plantar fasciitis, people really don't have to live with it. The nice thing is you can provide them with tools at home to work on themselves. So if somebody has trouble in the morning, they can take about 3 minutes before they get out of bed, do a little work, and when their feet hit the floor, there's no pain anymore. So welcome to the wonderful world of feet and the use of vacuum therapy for it.